The content of this podcast does not replace the advice of your healthcare provider. Individual cases and questions should be discussed with your own healthcare provider.
Welcome to the S.H.A.R.E podcast, where we talk about sex, relationships, and culture. I am your host, Carl. I'm the director of the S.H.A.R.E program, and this is my co-host, Cassie, who's not here. She unfortunately decided to be so offensive and get married. I can't believe it. She's having a great time. Her and her now husband are on their honeymoon. And so, Cassia, we miss you. We look forward to seeing you on the next show. We hope you're having an awesome time. We are, however, if you guys haven't noticed, in a new location. This is not a permanent location, but this is our Oakville location for the Atwell Centre. We're in our clinic here, and we're so very, very, very excited to have on the podcast with us as we talk about STIs, as it's STI Awareness Month, our clinic director, Jocelyn, and the nurse manager here at the Oakville location, Sue. Thank you guys for coming on the show. This is really, really awesome. Thanks for coming on.
Thank you so much for having us. Yeah, it's great.
So because you are brand new guests here to the S.H.A.R.E podcast, two questions. Basically, what is your professional background? That's the first question. And the second one is, what made you decide to get involved in Atwell in the first place? So, Joe, we'll start with you.
Okay. So I've been a registered nurse for 45 years. And most of that time has been in women's health. So at my church, there was a booth, and I thought, oh, there's something I could get my teeth into. I've got some stuff to offer there, and I met with Lois, and she said, come for training next weekend. So I've been a volunteer. I've done all the roles. I've been a volunteer. I've been a part-time, casual, part-time, and full-time. So
that's amazing. Yeah. So you just saw a Atwell booth at your church.
Yep.
And we're like, yes, I'll sign up for that thing.
Yeah.
That's so
And I
cool.
really didn't know what I was getting into.
Well, we're so glad that you did.
At all.
And Sue, tell us about your professional background and what made you get involved with Atwell in the first place. What was that spark?
So I'm also a registered nurse. My background is in pediatric critical care. And what made me get involved with Atwell? I had always been interested in, even back in college, I did like some of my public speaking about abortion and alternatives to sexual health conversations. And so when Joe actually approached me at our church, she asked me if I would be interested in coming and volunteering at first for Atwell. And again, I didn't know what I was getting into. So it was definitely more the unplanned pregnancies that I initially was coming for. That's what I was interested in. And then, the STI testing and treatment and conversations, that was all a bonus.
Lovely. That's all a bonus.
Yes.
Which is a great segue to the topic of our podcast today, which is just STI awareness. This is STI Awareness Month, and I pulled some stats from Canada Public Health from 2019, and they says, while sexually transmitted infections, STIs, are curable or manageable, and prevention can reduce transmissions, rates of STIs have been increasing over the last decade and continue to be a significant and increasing public health concern here in Canada. And the second thing I pulled from hpepublichealth.ca, and it says sexual health starts with knowing your risks. Dr. Ethan T. It's Tumishi. I probably slaughtered that name. It's Tumishi.
Looks good.
Looks good. Okay. Dr. Ethan T., medical officer of Health at HPEPH says, it doesn't matter if you've had one partner or many. If you identify as straight or 2S LGBTQ plus, or what type of sex you've had, if you or your partner or ERS have had sex without a condom or barrier protection, you may have been exposed to an STI. Even though sexually transmitted infections are common, treatable, and in many cases curable, individuals may be infected without knowing it and unknowingly passing them to others. And we see this kind of happening all the time, especially in our clinic. People come in and they get tested and they say, "Oh, I wasn't aware." And we're going to talk about that on the podcast, because one of the things that we aim to do is just equip parents, educators, and people who are listening, teens who might listen and tune into the podcast, with advice and tools and knowledge about these things. And STIs is a big issue. So the first question that we have, since we always talk about sex, relationships, and culture, is our sex question. And it is this is a question I've gotten from a student, and they said, "I've heard that people only go to the clinic when they realize that they have become symptomatic. Is it true that STIs only are present when symptoms are present? And when it comes to being sexually active, how often should a person get tested?" So, Joe, let's start with you. Like, when it comes to this question, as far as like, are STIs only present if they're symptomatic, and how often should people get tested? What is your medical opinion?
So it is definitely false information to believe that if you have no symptoms, that you're not infected. If you've had partners, more than one, if you were both virgins, and that would be the only way, but if you've ever had another partner, anybody, then there's a chance that you've been exposed to something and are now passing it on to other people. You do not have, most STIs do not have symptoms. And so, yeah, it's rather shocking.
Yeah.
And we see that all the time in our clinic, where people are just like, "Oh, I think it's, a good thing for me to come get tested now." And then they had come back and we treat them for chlamydia, gonorrhea, or syphilis. So some people do come in with symptoms. And if they're having clear-cut symptoms, then the doctor may choose to treat. But, or if someone comes in and says, "My partner just told me that they have chlamydia or gonorrhea or syphilis," then we would treat then, but also test.
When it comes to the STIs that we do treat here at the clinic, for example, we're in Oakville. What are some of the STIs specifically that we treat for here in our clinic?
So we test for the main STIs, so chlamydia, gonorrhea, syphilis, hepatitis B, hepatitis C, and HIV. And we can treat, as Joe said, we can treat for chlamydia, gonorrhea, and syphilis here in the clinic. HIV and hepatitis would be referred out. They're longer-term management. So, and as far as how often somebody should be tested, you were asking as well. It would depend on the risk factors. If they have multiple partners, it's a good practice before having a new partner to both be tested and then to be able to show each other, these are my results. I'm clear, you're clear. If you're having anonymous sex, multiple partners at one time, there's higher risk factors, and so you may need to be coming in a little more often.
I'll just piggyback onto that. We mirror public health's testing, so that's what we're doing. And their recommendation now is that you get tested every 3 months because it can take that long for the HIV to show in the blood.
Okay.
Now, if someone was having symptoms, then obviously you need to be coming in and we would test and treat. But they're recommending more along the lines of every 3 months to get tested.
So that actually leads us into our next question about how to have these conversations. And one of the questions that we get is, I don't even know where to start when it comes to having the conversation about STIs. What would be your advice in how to go about having these conversations with compassion? Because there's a lot of shame associated with just having any kind of sexual conversation, right? So how do we talk about these? How do we have conversations around STIs with compassion, but also with truth? What do you think?
I think, yeah, as with any conversation with our teens and young people, we need to be open, and shame should not be a part of it. When we're talking about sex, I think our feelings will really come across as well. So if we're feeling shameful, that's going to come across. So I think we need to be aware of that. Not be shocked with what we may hear as well. Try and just hold it in and maybe talk to a trusted friend later about, did you know about this? But I think, just not being shocked, just allowing them to speak, being open to that. If you're not comfortable with it, or just feeling like you don't have all the information, certainly referring to somebody who does is, I think, a great resource. We would certainly be open to having teenagers come by, even if they don't need STI testing, if they just have some questions and want to sit down and talk with a registered nurse, then we'd be very happy to have them come here. So referring to somewhere like Atwell or to the family doctor is also okay. Encouraging them to attend a S.H.A.R.E presentation would be wonderful.
Love the plug.
I think just being open and understanding and not just around sex, like with all conversations. There's a lot of stuff going on in the world right now that we did not grow up with, and just being a listening ear is very helpful.
Mm-hmm. I'd like to add also using a lot of facts. Like we don't need the shame part can come because of the emotion. And I think it's really important for people to recognize there are facts and to lean on those, because they can't be argued away or and there isn't a lot of emotion attached to them. So providing good information is really, really important. But also, as Sue said, that not having our baggage attached to it, because the shame can be so great. For some kids, actually, one of the clients that I had, I didn't, like I always ask, is this a concern of yours, or is this a routine test? And he says, well, I've never been tested, but I'm doing this for my son's sake. Because he wanted to be able to provide information for his son.
That's amazing.
So he came in to be tested and got all the information. I gave him exactly what I would to do anybody who was coming through the door. And so that can be very helpful too. The other thing, as far as family doctors are concerned, sometimes if it is the family doctor, that, especially for young people, that they don't want their family doctor to know at all that they are coming and they're getting tested, because the family, mom, dad, whoever is going to know, right? And that level of confidentiality is not always maintained. So it's we give a neutral spot for them to be able to come and to learn about it and get tested.
That's fantastic. So what I'm hearing you guys say is that if parents want to come in and check this out for themselves, you can kind of do like a mock or like an actual STI test, even if they know like everything's fine, so that they will have the tools and possibly a conversation starter with their teenagers. That's what I'm hearing, that they're invited to book their own appointments so that they can better talk to their teenagers. You guys are cool with that?
Yeah.
For sure.
Yeah,
for sure.
absolutely.
Yeah.
What a wonderful organization. That's amazing. So that's great. So yeah, because relationships are so tricky, just being able to have those tools, those resources, I've found, even as I go out and do the S.H.A.R.E presentations and talk to young people about STIs, I know that I've constantly, just referring to the nurses and talking to you guys, it's so helpful just to have that information, because it is a little anxiety provoking, like to even just start these conversations. And I think that ties into, there's a cultural piece there. And the last question we want to ask that is specifically around culture is that there seems to be a high level of anxiety that runs through our culture about STIs and getting STI results, to the point that people will put off even going to a clinic for a long time. What do you feel contributes to this anxiety? And how would you go about encouraging someone who is maybe on the fence about coming into getting tested to take that next step?
Strongly encourage anybody, and then we have people from 15 up to 80. If you are having sex with multiple partners, you come get tested. Get it done. And the anxiety, one of the things that I've recognized is that when they come back for their results, because we ask clients to come back for their results. We've had a lot of very intense conversations in their first appointment, and we like to follow up with the clients to make sure if they've had a change of heart in anything, if they have any other questions about anything. And one of the things that I believe that Sue does it too is that as soon as they come through the door, I'm giving them the results. Because the anxiety for some clients, it has been sky high as far as their anxiety level, because they've been worried about what their results are going to be and the impact it's going to have on them. So the good thing is that for several of the STIs that we can cure it. And the other ones we're going to be managing, right? So, and we're able to treat on the spot. So that's important too. So they know that they're going to get treated. They don't have to go someplace else for the treatment, that they can be treated right there and then. So, yeah, that's one of the things that we do to help take that anxiety down and coaching them through. Like, you know, we're going to get your results. It should be within the week, and we'll deal with the results when they come in, you know, so that we can encourage them that. But, yeah, anybody having sex, you got to get tested. Make it happen.
One of the things you said I want to dig into a little bit more, because I think it's so important, because people I talk to, there's not, especially with young people, they're just like, oh, it's an STI. That's the end of everything. Like if I get one, then I'm with it for the rest of my life. So, Sue, what are the STIs that actually are curable? And I think that's just important to know, because to break some of the stigma of like, oh, if I get an STI, I'll have it forever.
Right, yeah. So our bacterial STIs, the chlamydia, the gonorrhea, and syphilis, we can treat here right in our offices, in our clinic. And the ones that are more managed are viral, and that would be your HIV and your hepatitis. But yeah, again, the chlamydia, the gonorrhea, they're very quick. I think people are surprised how we can, depending on, you know, as long as they don't have any allergies to certain antibiotics, we can treat them in one dose right here in our office. Yeah, I think that removes a lot of the anxiety as well, is when they realize like this isn't even something that they need to take home for a while. It's not like a 7-day course of antibiotics, but it's done here quickly and efficiently.
That's amazing. Yeah.
I will add one thing to that.
Yeah.
So we enforce, and public health does too, that they need to be abstinent. No sex, zero, no oral sex, no kind of sex for 7 days after treatment. Because if they're with the same partner and the partner hasn't been tested and treated yet, they can just keep passing the infection back and forth. So both parties have to have been tested, treated, and be abstinent for 7 days.
That's great to know.
And then we bring them back for a test of cure.
What is that?
So test of cure is bring them back at 1 month and then 6 months. That's the public health recommendation. Our doctor, believes in the one month. And that's just doing the same sample. So if it was syphilis, we would do a blood test. And if it's gonorrhea or chlamydia, we would be asking for a urine test, just to make sure that the medications that we've given them have actually cured what's going on.
That's awesome. So one of the things that we always like to do is put tools in the hands of parents and educators. So I'll ask you first, Joe. What is a good tool that you feel that you can share with specifically teenagers to help them, navigate and have some of these difficult conversations?
I often will suggest to particularly young women, young girls or youth, that they consider with their friends role playing. And the role playing, I'll just play it out there. Like, so you're in a situation and the guy wants to have sex and you've said, I don't have any condoms. And you say, Okay. Okay. But that okay isn't okay. You don't want to go forward. What are you going to do? How are you going to play that back? So you want to be within a safe environment. So the role playing, and one plays one role and one plays the other. And what are you going to say to this guy? And the answer is going to be no go.
Yeah.
Because no sex with no condom.
Yeah, and this is something that we actually talk on within the S.H.A.R.E presentations about boundaries. Like, depending on what your boundary is, like, it's important that you know where that line is before you find yourselves in that situation. Because like a lot of times what will happen is we don't think about these things. We don't have these conversations beforehand as a preemptive. And then we find ourselves in situations where now we have to make a decision on the spot. And that's so much harder to do on the spot. Whereas if you've like, okay, this is my boundary. This is how I feel about, engaging sexually with a person. I know that for myself, this is going to make me feel the best. So because of that, and because I have that boundary in place, if and when that situation happens, now I know what my answer is going to be already. Yeah. And I have like legs to stand on with that.
So the other thing that I think, first of all, most of our clients have had sex coming through our doors. So they're getting STI testing not because they haven't had sex. Right. So we're always encountering people who have had sex. And with a variety of falsehoods that they're carrying with them. So I also like to play back, okay, this is something you weren't sure you wanted to do. Can you step back now and reflect on what led to that decision? And sometimes it was alcohol. Sometimes it was drugs. Sometimes, it's peer influence. And so just stepping back and being objective and saying, how is it that I got to this place? And what can I do now in the future to be able to change that?
That's awesome. I love that tool. So what I'm hearing is asking questions, communicate, and role play the situation out before you find yourself in that situation.
Yep. Sex is an intimate act. You should be able to talk.
Yeah. Yep. That's always good. And when it comes to just another practical tool for parents, for educators, you made an amazing remark, Sue, when we talked about this offline, and I would love for you to share that as well.
Yeah, I think simply just that, don't assume that your teenager is not having sex.
What? What?
Shocking.
I was doing some research before coming here to Oakville and Halton. The average age, or the median age for males having sex is 17, and for females it's 18. So that is the median age. If they're not having sex, that's wonderful, but they are always just one decision away from possibly having sex. So having these conversations with them before they get there, it's important.
Yeah, and I think that is crucial for us to understand. And I thank you for sharing that, because, growing up, when I talked to my mom about this for the first time, it was like, what? I didn't even realize that you were thinking about these things. And a lot of times we don't assume that, our teens are going to be exposed, or we don't understand the level of exposure that they've already had to these kinds of activities, or especially things that they see on the internet. They're being exposed to what sex is and what it looks like in a way that maybe not be the healthiest for the most part. And so having conversations early and not making those assumptions, crucial. As a person who goes into high schools and to elementary schools, I was there today in an elementary school. Every single one of those 7th graders, when I said the word sex, knew what that word meant and had images to what that word meant in their heads. Almost every single one of them. So I think it's vital to know that, like, we can't assume that they're not being sexually active. Right. We can't take that position. Not my kid. Definitely your kid.
And who do you want them to hear it from? Do you want it to be the internet or their peers, or do you want it to be yourself or a trusted professional?
100%. So with that, I know that we're running out of time. I do want to thank you guys both for coming on the podcast. I'm super excited for our next segment called Real Talk, where we're going to get into even more nitty-gritty medical questions. It's going to be so much fun. But I know that we are looking for, support here in the clinic, specifically with volunteers. And so, Sue, if somebody wanted to volunteer here at Oakville, what are some things you're looking for in volunteers?
Well, here in Oakville, we are very much in need of volunteers because we are new here. We are looking for registered nurses to help with our clinic, and training is provided. At this point, I'm the only RN here, so when I need to go away or something, it's Joe, come. So definitely needing some help there. Our center manager, Pam, also needs some help with administrative duties. So if that is somebody's, if that's something they're really good at, then yeah, we would definitely love to have them here in Oakville. And if you like to fold baby clothes, we can find something for you to do. So yeah, definitely.
Awesome. And same question for the Hamilton location. Joe, what are you looking for as far as volunteers?
I am looking for RNs. Absolutely. We are growing. As you've heard, we have 2 sites. If my executive director has her way, she would have a whole bouquet of sites. But at this point, I'm still needing more nurses, and they must be RNs. But like any other organization, doesn't matter what it is, there are roles for people. And whether it be bookkeeping or if it is doing big events, or if it's just coming in to do your 40 hours of volunteer time. There's all kinds of different opportunities. We need someone for our desk too. So Erin is our center director or center manager, and she likes to be called a director actually. It needs relief too. And so we need someone that can come in and train with her. So we've every area we could use more people, and we would love to see you, and we would train you as nurses. Yes, we will train you. We have an exciting program because with our medical, we had introduced POCUS, which is point of care ultrasound, and so we are doing training for that. To be able to allow RNs to be able to do the point of care ultrasound. So it does add to your resume, and if it's part of your wheelhouse, then it's exciting times, then we'd love to see you.
Awesome. And just again, because we're talking about STIs, STI awareness, we do want to let people know that if you are in a position where you want to be tested, where you want to come in and make an appointment for the clinic, you can come to either our Hamilton or Halton locations. If you want to make it if you would like to make an appointment in Hamilton, you can reach them at 905-393-8525. And if you want to come to the Oakville location, you can reach them at 289-529-0219. And those informations will be somewhere. Lucy will do a thing. Lucy, do the thing.
Great. And we can book online too.
And we can also book online as well.
Site.
Yes. And also, in addition to that, Sexual Health Ontario does offer information and support on sexually transmitted infections, birth control, and more. Individuals can also live chat online with a sexual expert 7 days a week. So you can visit them at sexualhealthontario.ca. So that is our show for this week. We are super excited. Please do tune in for next week's Real Talk, where we're going to ask questions like, what's a pap smear? Why is it important to get screened for STIs, and when should that happen? Should you do it before, or should you do it after, during? What should I do if my boyfriend doesn't want to wear a condom? So like really good questions that we're going to just dig into, and it's going to be a great conversation. So as always, thank you for tuning in, and don't forget to share.